Hello and welcome to NHIS in a Week. We bring you highlights of events within the authority and the scheme. Now the headlines. The CEO of the National Health Insurance Authority, Dr. Da Costa Abuaje, unveils plans to introduce a promotive preventive package. NHIA and Kofi collaborate to strengthen healthcare in Ghana. NHIS district managers recognized for outstanding performance. The CEO of the National Health Insurance Authority, Dr. Da Costa Abuaje, unveils plans to introduce a promotive preventive package signaling a transformative phase for the country's healthcare scheme. Backed by Parliament's approval of 3 million Ghana cedis for pilot implementation, Dr. Abuaje aims to enhance healthcare for all citizens through the NHIS. He said this during an interview with Joy News Crew at his office in Accra.
As part of my vision, I'm proposing that at least we should have what we call promotive preventive benefit package as part of our insurance scheme. Now, what is this promotive preventive benefit package? This promotive preventive benefit package is a package which will give, let's say, every Ghanaian an opportunity to have a health check. It is once a year on their birthday with a simple text message. What are you doing with that? One, you detect the diseases early so that they don't even get to its worst form. Two, you are able to, you'll be increasing life expectancy, because at the end of the day, when you screen and categorize it under what we call the red, gold, green in medical field. So the red is where you need more attention. The yellow is where you put them in the borderline and monitor. The green, they are okay.
Representatives from the Kofi Foundation for International Healthcare, Kofi, met with the NHIS CEO, Dr. Da Costa Abuaje, to discuss their ongoing collaboration aimed at achieving universal health coverage in Ghana. Since 2013, Kofi has supported NHIA in various capacities, including membership enrollment, claims management, research, and staff capacity building. Currently, they are working on a joint project focused on developing a research policy and agenda for the authority. Dr. Abuaje expressed gratitude for the progress made and affirmed the NHIA's commitment to strengthening ties with Kofi. The Professionals and Allied Workers Union, PAU, marshaled a seminar for its bona fide members who are retiring from active service at the National Health Insurance Authority from 2024 to 2026, respectively.
This program is actually a seminar that we have organized to prepare our members who are due for retirement. They are going on retirement from this year, 2024 to 2026. And so we are preparing them to be able to take care of their retirement, what they eat, how they handle their health, and even their finances. So we only want them to feel comfortable when they are at home. That is why we have assembled facilitators to take them through, experts who are in financial, health, and diet field, to take them through and prepare their minds towards their retirement.
I've had the opportunity to come and interact with our staff, NHI staff that are going to retire from now till the next 2 years. I've noticed that most time people don't know about this process. So this was a good opportunity to come and educate our retirees on this process. I'm sure HR has done that already, but it was an opportunity to come to also add on to let them know. And some had questions of how long it will take for them to get their benefits. And so this afternoon we've shared with them that once the form is completed by law, we have up to 30 days to pay their benefits.
One of the things you need to be aware of in your retirement period prior and when you actually start retirement is that it's not the end of your life. You are entering another phase of your life. So begin to look for things that give you meaning so that your mental health is kept in a good space. So connect with your family and join your old school reunion group. If there are groups in your community with older people that you can join and learn from them, interact socially. let that aspect of your life also come alive.
The event was hosted by the Deputy Chief Executive Officer in charge of Admin and HR, Dr. Mrs. Yapukia Badin, who in a heartfelt address commended the retiring members for their long-standing service, loyalty and dedication to the organization.
I want to express my deepest appreciation to each of you here for the years of dedicated service, loyalty and commitment to NHIA. And may this conference serve as a beacon of hope and guidance as you prepare to embrace the next phase of your journey in life.
The NHIA, in collaboration with the University of Ghana Business School and Korea Foundation for International Healthcare, Kofi, has initiated a 5-day knowledge-sharing executive program aimed at enhancing the capacity of NHIA staff at all levels. Led by Professor Gordon Abekan Kroma and supported by Mr. Sebastian, Deputy Director of Membership and Regional Operations, the training focuses on health policy analysis and understanding in the healthcare landscape in developing countries, particularly in Africa. Dr. Mrs. Yapukia Badin, NHIA's Deputy Chief Executive for Admin and HR, expressed gratitude to Kofi for their ongoing support and urged for an extension of their collaboration to the benefit of more NHIA staff.
We are here because Kofi has a collaboration with NHIA. Since 2013, it has helped NHIA in our claims management process, in our membership drive, also capacity building, and also in research. And I must say that we have trained over 80 staff in data analysis, and that's been through the help of Kofi. Again, what we have done is that through Kofi, we have had a joint collaboration with the University of Ghana Business School, for which we have developed an MOU with them for the Health Insurance Knowledge Sharing Center. So there was a first cohort that was trained in comparative health insurance. We had staff from NHIS and then visitors coming from Ethiopia to learn about health insurance, and then they also shared their experiences from their various countries.
Well, actually, I was here to monitor how the Kofi's health insurance project is going on right now, and I heard that this is the second knowledge sharing program that, under this project, so I wanted to see how the program is being operated and how much NHIA staff are interested in this program. So, and I think it is operated very well, and there's very high passionate staff that is involved in this program, so I'm really happy to see this today.
The health policy analysis training course, which is being held at the University of Ghana Business School in collaboration with Kofi, it's a very, very important course. It's been very, very exciting. It's been very, very insightful. It has exposed a lot of the things that we need to know regarding policy formulation, policy implementation, how to evaluate policy, and the impact it has on the population that this policy applies to.
As a management member of the NHI, so much has been learned, and it's going to go a long way to help in my work as far as claims processing is concerned. So many things that we can work together with all the stakeholders that matter when it comes to claims processing. And I believe that what I've learned here will be actually applied going forward.
We are grateful to the Korean Foundation for International Healthcare for sponsoring this. In addition to capacity building, they are also helping us to do research. So we have, with their support, we have developed research policy and agenda, which is guiding how research is conducted, either by the NHIA itself or in collaboration with other stakeholders.
NHIS district managers who excelled in the 2023 operational year were recognized for their outstanding performance in a ceremony. Selected managers were rewarded with an opportunity to participate in the capacity building program at the University of Ghana Business School, funded by the Korea Foundation for International Healthcare, Kofi. This initiative, based on the 2023 performance indicators across the 16 regions, reflects executive management strategy to incentivize and reward high achievers. Additionally, other high-performing districts had previously benefited from similar training sessions held at the same venue. CSR Team Ghana, a diaspora charity organization, organized its annual health screening event in collaboration with the Lankwantana Medina Municipal Assembly, NHIA, and the Ghana Tourism Authority. Held in the Greater Accra region, the event aimed to provide the community with access to water and equal healthcare services, particularly by facilitating NHIS registration for children and less privileged. Over 101 children and 165 informal sector individuals were enrolled on the scheme, while attendees received free health screening.
Our target is to sign up at least 200 people on National Health Insurance Scheme. A lot of times people, just a little 30 cedis that they'll pay to sign up for NHIS, they don't have it. And so we came here today to make sure that we sign up as many people as we can for national health insurance, as well as renewal of their cars, so that they can have that little part that will help them. We also have doctors here, and we're checking for diabetes, we're checking for high blood pressure. These are two illnesses that affect Black people all over the world.
NHIS representatives also raised awareness about the scheme's benefits, medicines list, and the newly launched My NHIS app, aligning with the drive for universal health coverage by 2030. The NHIA, in partnership with F Alpha and Omega Specialist Hospital in La Quantanan, facilitated the registration for residents of Medina and surrounding areas during the hospital's inauguration in the La Quantanan Medina Powerland area onto the scheme. The hospital, offering various medical services including general OPD, obstetrics and gynecology, pediatrics, ENT and dental care, plans to establish an IVF specialist clinic with international collaboration in the future. Mr. Owusu Theophilus Ansa, Deputy Director of Claims Processing Center in Accra, commended the hospital's initiative in addressing community health needs and increasing NHIS enrollment.
I want to believe today is an important occasion because anytime we have the chance to talk about health, it's a big occasion for us. I was very happy when I was told that not only are we going to handle this race, but in the course of it, we are going to register people onto the health insurance. Anytime we get a chance, we want to register as many people as possible. This is a hospital and it's going to take care of curative. It is my hope that Mr. Mosu, it is my hope that as you take care of curative, you shall also look at regenerative health. And so I'm praying that the day will come and then we will see a gym somewhere or a wellness center somewhere where anybody can just walk in just to check their pressure or to see whether the person is diabetic or not.
Moving on, the Quality Assurance Directorate of the NHIA, in partnership with USAID, organized a groundbreaking meeting in the Central Region, attended by diverse groups of healthcare facilities from all levels of care and ownership. The program aimed to address specific issues identified in clinical and compliance audit findings, focusing on the Central Region. Led by Mr. William Omani Ejekum, the Deputy Director of Quality Assurance, the meeting emphasized knowledge sharing to enhance healthcare quality, patient outcomes, and best clinical practices. Ms. Mary Adomensa, representing USAID, emphasized the importance of cooperation and interactive learning to improve care delivery and elevate standards. Participants received valuable insights from presentation on audit findings and data analysis, signaling a collaborative effort towards achieving universal health coverage through the NHIS. Good. The NHIA Western Regional Office conducted its 2023 end-of-year performance review meeting in Sekondi, aiming to assess achievements and set strategies for the year 2024. Led by Regional Operations Manager Mr. Kwame Natechi Arthur, the meeting emphasized the judicious use of NHIS blank cards and digital platforms for enrollment, teamwork, and commitment. The region achieved notable percentages of its targets, as highlighted by Senior M&E Officer Mr. Vincent Ahiabu. Group presentations by district officers showcased achievements, challenges, and strategies, while the regional MIS manager reviewed the 2024 program of work.
Hey, Swagger, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for internet. But no shaking. I have NHIS already.
After you're on a line, ting.
Ina, look at you. What are you going to do in the office when you can just download the app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Please, Seth, I'm starting work next month.
This is how we wrap up this week's edition of NHIS in a Week. For details of these stories and more, do log on to our website www.nhis.gov.gh or follow us on all our social media platforms displayed on the screen. My name is Vida Iduchimwa Boateng. Thanks for watching.